Well, I think the journey for arthritis is really highly individual. But if you were going to say, how does it go for most people? First probably starts with a developing awareness that a person is having problems and limitations. And that can be a very subtle thing, noticing that you can't walk as far as you used to. But over time, for a lot of people, it becomes more and more problematic. And everybody has a line in the sand where it becomes a bit more intolerable and they have to seek out care. And they can seek out care in a bunch of different ways. Typically, they'll see a primary care provider first. They'll start some initial non-operative treatment options. When that ceases to work for them, they typically are then referred to a surgeon for a consultation for joint replacement.